All right, well, welcome everyone to this webinar on lab testing for, well, the original topic was thyroid, but now it's kind of thyroid, immunity, blood sugar, Epstein-Barr, and sort of how it all relates to immunity and this time in our lives right now with coronavirus. So I'm going to share my screen for people who are on the webinar or watching the video. Unfortunately, I can't really do that for Instagram. Hi there. Just because I can't like share a screen the right way, but I can maybe share a few things as we go along. For instance, this is a reference book for Epstein-Barr that I was using today to get ready for this this presentation. Okay, so I am actually going to share with you my own lab results because it gives us a nice frame of reference for what we're doing here. So, and I'm just going to make a note. Hi, Natalie. Hi, X-Truly. We're talking today about labs and immunity. And unfortunately, Instagram can't see everything that I'm doing with the webinar, but you can listen along. So I just want to point out I have this Google Drive folder where I'm keeping my labs, and it's a great idea to keep your labs in the same place so that you can go back through time and kind of see how they changed and just have them all there if you see a new practitioner, that kind of a thing. So I actually did find a pretty interesting time difference that I will show you here soon in my white blood cell count. But this is my lab test from, when was it run? August of 2019. So as we were rolling out our first blood testing service, I ran it myself to just, make sure it all was working smoothly and that kind of a thing. And so this gives me a good way to show you everything that we test for. So at the top here, you're going to see our thyroid panel and what's in it. So you're seeing free T3, total T3, free T4, total T4, thyroid antibodies, and reverse T3. This lab will just show kind of traditional ranges, like standard ranges, and not necessarily the functional range. So I'll tell you a few things that are off or okay with my own labs. First thing you'll notice in red is I have some thyroglobulin antibodies. So that's a sign of Hashimoto's. But you can see that my number is 3 and in range is 1 or less. And you can go high into the thousands. So having a 3 really isn't that bad. I'm, pretty much practically in remission to Hashimoto's. So that's really good. And I used to have a little bit with both the antibodies, and now one was in range. So that was really looking a lot better for me. But, I'm still technically have Hashimoto's, and we'll talk more about the significance potentially of Hashimoto's on immunity. Let's see some other things. My free T4 was borderline, but okay. My TSH, I didn't mention TSH earlier. Where's my TSH? When I kind of printed this or pulled it up, it kind of pulled up a little weird. I don't know where my TSH is. It should be in here. We'll look at my old lab to see my other TSH. One thing that I did not like on this was my free T3. It's at 2.8. I'd like to see it at least at 3, but I'm going to feel better at 3.2 or higher. So some things you can kind of tell from this test for me personally, and I don't know why, but it might be on the TSH may have landed on a different page, just the way I pulled it up. I'm not sure what happened, but when you do a full thyroid panel, you can see what went wrong when. So say, for example, my TSH is pretty normal. Some of my total numbers are normal, but then my free T3 is low. That's a conversion issue. And that could be from stress or from my liver health or my gut health. And those are kind of the hardest ones to treat in a way, because you're really treating the whole environment of the body. But the good news is that a lot of things like upstream, are looking okay for my thyroid, and then my antibody is like almost gone. So that's all good news. Any questions about this section from anybody? And TSH, ideally is around 1. Sometimes up to 2 is okay, but ideally TSH you want to see around 1. And we can see that again in another test that I ran. Okay, don't see any questions, so I'm going to go on to the section about, actually, let me stop. Time out. Let's talk a little bit about thyroid and immunity and autoimmunity. So, technically having a low thyroid doesn't necessarily make you have low immunity. However, if you're a person, you have low thyroid and you are always catching colds and flus, like, know that about yourself, and that is something to work on for you. Having autoimmunity can affect your white blood cell count and your lymphocyte count potentially, especially like lupus. We're going to talk more about that later when we get in the white blood cell section. But I wouldn't say like, oh, you have Hashimoto's or you have low thyroid, like you're definitely in trouble. I think that's an overstatement. I think that you should work on your thyroid and your gut and whatever needs to be worked on. And we should look at your white blood cell numbers, but I don't think we definitely know, that you're at greater risk for like coronavirus, for instance. So let me kind of go to the next section. The next section is about blood sugar. And this is a section where we actually have added a marker. So we've added fasting insulin just to get a more robust sense of what's going on with your blood sugar. So this section is actually pretty important when it relates to immunity, because diabetes or prediabetes makes for a weaker immune response. And I'll do some more research about that, so you have some studies and stuff to look at so you can like kind of follow through on that. But blood sugar does matter for immunity. So one of the worst things you can do right now is like be eating sugar or drinking wine or like having a lot of processed foods. And I know that's tough in the places where you're running out of food, but try to just still get fibers, protein, fats, and try to avoid too much spiking of your blood sugar. Also get exercise. Exercise reduces insulin resistance. So get exercise, take walks after meals, go on a bike ride, keep moving. There's no restriction on just walking around your neighborhood. So this particular test, if you can see and you're on the webinar, I did not fast for this test because I have a home glucometer, so I don't really need to like know my fasting glucose. But let's just say this was my fasting glucose. This is too high. We want to see it at 85 or less. My hemoglobin A1C was perfect. You want to see it at around just like at 5. You don't really want it over 5. So hemoglobin A1C is a long-term marker of blood sugar. So it won't change for like 3 months. So if you're trying to work on your blood sugar, you have to wait at least 3 months to retest. It's kind of like how sugars are sticking to proteins. And then the last thing that we added to this panel, and we didn't increase the price at all, was fasting insulin. And that can give you a better idea if you're insulin resistant. So that's all, I think, really helpful for immunity. And I've been very surprised since we started running this test back in September, how many people have just a little bit of prediabetes. Not enough that your doctor would say so, but I will tell you so. I can't diagnose that, but I will tell you if you're beyond the functional best range for your sugar. And that does affect not only your immunity, but your waistline. A lot of that will be like a fat around the middle. So if you're concerned about fat around the middle, you may want to run this test. So this test we call the Thyroid Plus lab test, because thyroid is kind of star of the show. Everyone wants to know about thyroid. A lot of people can't get that tested correctly at their doctor's office. are, interpreted the way they want in a functional way. So thyroid is kind of the star, but I'm so thankful we have several, sections of this test, because sometimes you think, oh, I'm tired, it must be my thyroid, or oh, I can't lose weight, it must be my thyroid, but it's actually more to do with blood sugar or red blood cells or something. So that's a little bit about the blood sugar section, great for weight loss resistance. Good to know as a baseline for immunity. Again, you could retest like in a year. Are you getting better or are you getting worse? With our advice, hope you're getting better. You're moving those scores in the right direction. So we can give you advice on supplements and lifestyle for that kind of pre-diabetes. Next is a ferritin marker. That's like a long-term iron storage. And this one's tricky. Everybody has a different opinion, but ferritin, I think I'm a little bit low here on ferritin. And then here's some red blood cell markers. I won't go into these in too much detail, except to say that your iron levels, your levels of folate and B12 make a difference on your red blood cell performance. And red blood cell delivers oxygen to your cells. So you can feel fatigued or brain fogged from not enough oxygen. And you could be out of breath, you could have shortness of breath, you could think you have coronavirus because you have shortness of breath, but actually you're anemic. So we catch some of this when people run labs with us, and we can recommend iron or B vitamins or a change of diet, that kind of a thing. Anemia is associated with some low lymphocyte count, and lymphocytes are some key white blood cells for fighting viruses. So again, sometimes like things that aren't that sexy or talked about are still really important, like anemia. And anemia is common with age. We have less stomach acid, we're not pulling iron out of foods, we're not getting enough nutrition out of our foods, then we can end up anemic. It's actually pretty common in older adults, especially women. And then you could be having shortness of breath, you could be having less immune response. So it's actually really important to know this. Okay, white blood cell count. So white blood cell count, honestly, when this has been on here in the past, I would just use it as like a little clue about, do you have a gut infection? That's kind of the main reason I would say, oh, well, this is looking kind of high or low. You're probably dealing with some infection. But now I've been digging into it a little more, and I'll share some of that with you. So again, this is kind of in a weird order, but here's my white blood cell count, total count at the bottom. And it's normal. But I'm going to show you that in 2018, it wasn't normal. It was too low. And we'll talk about that. So there are various types of white blood cells, and they work on various types of infections. Some work better on parasites and indicate that you may have a parasitic infection. Some are more associated with viruses. They're all just mount a different response in a different way. But the one I want to kind of emphasize is these lymphocytes, which make the T cells and B cells and natural killer cells that you may have been hearing about in relation to coronavirus. So you don't want your, in my opinion, you don't want your white blood cell count too high, too low, and you don't want your lymphocytes too high or too low, but mostly you don't want them too low. You want to be able to mount a response to a virus. As much as there's this talk of cytokine storm and stuff, we do need to mount a response to the virus. That's important. So if your white blood cell count is low and your lymphocyte count is low, I think that's a little concerning. Now, what if it's high? What if your white blood cell count is high? Well, let's back up a bit. So white blood cell count being too low is often like it's exhausted. It's been fighting something for a long time and it's depressed, or you're taking medication that is depressing it. White blood cell count being too high, being very high, means you're really mounting a lot of response already, maybe to infection of some other kind. We can go into that more later. when I dig into those notes. But it's sort of like, are things too high or too low? And some people have written in and said to me, well, my immune system is overreactive, so I don't want to stimulate it. Well, I would ask, how do you know that? I don't think you know that unless you see these results, or you've got maybe some other blood markers about inflammation, or a doctor's told you that. I wouldn't assume you have an overactive immune system based on the fact that you have autoimmunity. You may have an underactive immune system. So when you're making a conclusion, make sure it's based on facts, because I think that some people are making the wrong conclusion there. So based on this information right here, I ran this in August, but let's say it was true today. My white blood cell count is fine, and my lymphocyte count is also fine. I'll show you my old results where it wasn't so fine. My vitamin D, just ignore that one because that's D2. My vitamin D3 was okay. We like it to be at least 60 up to 100. So to me, this level of vitamin D is okay, but I should still maintain it with 5,000 IU vitamin D in the winter months and in the summer months if you don't go outside. So this is a really important marker for immunity, right? Vitamin D. It's also really important in autoimmunity. Many, many, many people are low. So we can address how much to supplement with if you see that your vitamin D is low on your result. Okay, I guess that's all I have to show. So to sum it up, you will get a white blood cell count and breakdown. You will get a red blood cell count and breakdown to tell you about anemia. You will get a full thyroid panel, and you'll get this blood sugar panel, and you'll get a half an hour with us. So you do need to go to a local blood lab, and once you've ordered with us, we find you your nearest lab. The labs are still open and running normally, and if something comes up and you can't go to a lab anymore, this is good for 2 years. The lab order is good for 2 years. So if you need to push it out for a month or something like that, it's okay. Okay, now I want to show you this lab I ran with another company that we were testing out in August of 2018. So it was 1 year earlier. And you can see right here on top, my white blood cell count was 4.1. That is too low. So again, this is within the gigantic lab range that they put here, but in a functional perspective, it's too low. So I wasn't feeling as well back then. I was still recovering from mold. I had Epstein-Barr that I'll show you here in a minute. But I was more depleted then. But if you look at my lymphocytes, they were still okay. The percentage was okay, and the total was okay on my lymphocytes here. My glucose, I don't know if I was fasting, it was so long ago, but that would have been fine because it's under 85 we learned about, right? There's just some liver markers. So some of these are not on our newer lab. Here's my my TSH back then. It was 1.37. So it was fine. I'll see my ferritin, maybe it wasn't tested, but I wanted to show you my Epstein-Barr markers. So a new service that we just started to offer was Epstein-Barr virus testing. And then as this coronavirus happened, I thought, oh gosh, nobody's going to want this Epstein-Barr testing. However, you may want it because having a virus can depress your immune system, and you might have a hard time telling what is your Epstein-Barr symptom versus what is your coronavirus symptom. And that's a pretty useful thing to know about. So these 3 markers I have here of Epstein-Barr. Hi guys, feel free to ask a question. Hi Shannon. Hi Gemini Queen. If you have one, just ask away as I talk. Again, I got this book out earlier. This is one of my reference books for Epstein-Barr by my friend Kasha Kynes. And this test you're going to look at here has 3 markers, but our new Epstein-Barr test has 4 markers. I'll show you that in a second. But let me go over these markers for you. Actually, let me blow it up so you can see it better. Okay. So I have 3 markers here. 1 of them was positive, 2 of them were negative. So the 2 that were negative, they didn't even give me a number because they were like considered below range. Those 2 markers were early antigen. That's something that's going to show up in the late acute stage of a flare-up. And it didn't show up for me. Maybe, I think because I wasn't really, I think I was just in a low-level crappy stage. This VCA IgM, that one also flares up with reactivation, but it won't necessarily flare up to a high number. So it was negative, so it might have been flared up, but not enough to show up on the test. Now the last marker here is VCA IgG, and that one is one that you're going to be stuck with for life once you've been exposed. 90% of adults have it. Can also show up in reactivation. But what's important here is that my number is so high. So it says positive is above 21.9, and I was at 211. So this to me is showing that I'm not feeling well. My body's dealing with a lot of virus. You know, if I had no symptoms, maybe then we'd just say, eh. But I was having symptoms. I was having, you know, swollen glands, sore throat, nighttime chills. And that was in a pattern that was pretty chronic. So this is one differentiation potentially from coronavirus. Like a flu that comes on quicker and, you know, fever and cough are 2 hallmarks, but you could have other symptoms like this. But I would say know yourself, know your chronic conditions so you can know it's different. And treat your chronic conditions, because then you won't have so much mess to be sorting out and you'll have a stronger immune system. So here I was with some pretty active levels, pretty high levels of Epstein-Barr virus and low white blood cell count. So no wonder I wasn't feeling that great. Probably this chronic virus was depressing, wearing down my white blood cells, which have come back up now, so that's good. And I haven't retested yet for Epstein-Barr, but I'll show you real quick. Epstein-Barr testing that we are doing has the 3 things I just showed you, plus 1 more marker called nuclear, up here, nuclear antibody. So nuclear antibody would have been interesting for me to test that. It's also positive in most adults, but my question is, how high is it? How high is that level? That would have been interesting for me to know. So let's just take a quick whoops, I forgot to give you guys this. Let's just take a quick view of what I'm talking about. Diane, yeah, the 4th marker that I didn't run on, and then the old one was the nuclear antigen. Yes, and it's a kind of a chronic marker, but what's the level? So Diane, you said you were 169. I would look at what your range was. What was your range? 0 to 15? Then 169 is pretty high. If its range was 0 to 150, then it wasn't so high, right? You're welcome to share that. This Epstein-Barr testing is super confusing. It took me a long time to figure it out. And it still could be a little confusing. But I think mostly we will get a sense of it for you from looking at your results and correlating your symptoms. You know, unfortunately, usually when we have something, we also have other things. So we kind of have to sort through that. So private coaching, actually, I'll show you our March specials. We are getting, oh, they fixed it. We're getting our shop redone. So this wasn't showing yesterday, but I had them change it back. Right now, the thyroid testing is $50 off. The chronic Epstein-Barr testing, $50 off. And the big 3 tests is $150 off. Whoops, am I sharing my screen still? Oh my goodness. Okay, so here's those things that are right now showing on the March specials. They will later move back over to private coaching. I'll show you the thyroid testing options. So you can just do the testing we first talked about, the blood sugar, white blood cell, red blood cell, thyroid, and that is currently $350, and it includes a consultation with us, guys. So it's a really good deal. Like, it's a really good deal. If you want to add in EBV testing, it goes to $557. So it's quite a bit more, but the Epstein-Barr testing is expensive. But if you need it, you might as well bundle it together. It'll save you the money on having to do it separately later. So you just click that if you want that or not. And then the EBV testing by itself with a consultation, if you only want that, that's $350. So it is cheaper to bundle it, right? You're saving like $200 or almost $200 to bundle it. And what happens once you purchase is that you get some emails from us telling you where your local lab is, telling you how to take the test. Usually there's no extra fee, but occasionally you may need to pay like $10 at a lab, especially if you're like in the country. The last testing we have on sale is the big 3 tests. That includes the basic thyroid plus test I just talked about, a Dutch hormone test, and a GI map stool test. GI map stool test, also a great investment right now because, hi Kara, because 80% of your immune system lives in your gut. So if you have gut infections, you have leaky gut, you have poor nutrient absorption, it is making you more vulnerable to immune deficits. There's also a lot of lymph that can gather around the gut, and you can have poor detoxification if your gut is inflamed. So not everyone can see this on Instagram, but on the webinar you can see these options. Okay. Any questions from my webinar people about any of this? Otherwise, so this is through March. It's what, March 18th or 19th now? So that's through the end of March. So you have about another 10 days or so. What else was I going to tell you about? It's my dogs. A little bit more about coronavirus and what you should know about your body. Again, I wouldn't assume you have an overreactive immune system unless you know that for a fact. I wouldn't assume you have an underactive immune system unless you know that for a fact. But if you do have some ongoing health problems like Epstein-Barr virus, like autoimmunity, they are going to factor in, and certainly to how well you feel. Hi, Patty. So you do want to keep learning about those, working on those. Autoimmunity here's a few things that can depress your immune system. Prediabetes, diabetes, steroid medication, chemotherapy. Hold on, I lost my list. Some other medications can do it. Alcoholism can do it. These can lower your lymphocytes. Sorry, I don't know where my, oh, here we go. Recent use of antibiotics, recent illness, heart conditions, and again, autoimmunity like lupus can lower your lymphocytes. Gastric cancer, low lymphocytes that are really truly low on a lab are associated with an increased mortality rate. So it's worth knowing, right? I think it's worth knowing, especially if you've been sick for a while, you haven't tested for a while. You know, why not get us some blood labs and figure out where you're at now? Hopefully you'll get some relief, but you'll also maybe learn a few things that you should address. Let me see some other questions we've had that I could perhaps answer, but feel free to ask them here on the webinar and I'll finish up pretty soon here. So now is your chance. One thing that's been coming up is this question about the cytokine storm and should I not take certain herbs for that? I think there's a little bit of misinformation or speculation going on about cytokine storms. Cytokines are inflammatory compounds that will be increased by your immune system, but it's part of a normal response. And what sends you into a cytokine storm? I don't know if we know that for sure to be certain herbs. I don't think there's any proof of that. Just because we know an herb increases cytokines by increasing immune response doesn't mean you're going to get into a cytokine storm and die. I just interviewed someone yesterday who has a different point on that, but I need to see the literature. I don't think we can jump to conclusions on all that stuff. But I will say, don't take herbs unless you're already sick. And if you become sick, you should call your nurse line, see if you need to be tested. You should do all the standard things. Don't become like your home doctor if you think you have coronavirus. Don't do that. What you can do safely is work on prevention with things like exercising, getting sleep, managing your anxiety, drinking lots of water, having lemon water, having as many greens as you can, avoiding sugar, getting sunlight, moving your body, having magnesium, having fish oil, taking your multivitamin, taking vitamin D. I think silver is okay to take a little bit of silver. If you do have asthma or you have irritated lungs, definitely be taking our chelated magnesium and a spoonful of fish oil twice a day. It'll calm a lot of that in your lungs. You may want to look at doing a nebulizer on Amazon that you can find with water and a little bit of silver. Those are some things to do. So yeah, I would stay off the herbs, straight up herbs right now. Vitamin C, I've seen a little controversy on too. If you are oxalate sensitive, apparently taking vitamin C supplementation could irritate that. I guess this is possible, but I don't necessarily think everyone needs to avoid vitamin C either. You mostly have an oxalate problem because you have candida or mold. So work on those things. Do your coffee enemas, do your castor oil packs, use your sauna. Use our, what's it called? Mega Mycobalance. It works on candida for you. Some of the foods that you can eat: peppers, citrus, beans, kelp was one that came up on our call yesterday. Diane is saying cytokine storm can be managed with whole spectrum CBD. There is misinformation that a cytokine storm can occur upon reinfection with COVID-19. Diane, do you have a study on cytokine storm and CBD? Or do you have is there a case study or a full study about that? Green Med Info, okay. I really like Sayer, but I think he's been very down on this whole virus thing, like it's a conspiracy and we're so I would look at that though. I think he's a good researcher. So yeah, anything that's anti-inflammatory could potentially help with too many cytokines. That's why I'm saying avoid sugar, have magnesium, have fish oil. Those are kind of my big things. CBD can be great for a lot of people. It also can be because there's usually teensy tiny trace of THC that can be bad for brain inflammation if you have brain inflammation, like in a mold case. So you have to be a little careful with CBD. Just depends on the person. CBD is an immune regulator. Yeah, that would be a good article to find out more what CBD does for the immune system. You know, one thing I think is going on right now is like some herbs and vitamins are running out, and people are like, oh, I can't take this one thing, I'm screwed. And that's not really true. There's so many things that modulate your immune system, that, you know, boost your energy. I just saw a mention about melatonin and immunity, which I didn't get a chance to research yet, but you know, just getting a great night's sleep, getting melatonin, which is an important hormone in itself, may be really important for you for your health. So there's potentially like a lot of different substances that can help. Yeah, so again, I'll show one more last time my screen share about the shop and stuff. I want this one now. Let's see. Let me make sure. So if you're still kind of looking for supplements, please see this article. I did a lot of research on supplements, mostly that we carry and how they work, and I have all the information. Doing things like dry brushing is a great idea. Kind of seeing that mentioned here in the article. And then if you want to take advantage of some of these testing specials that end when March ends, the Thyroid Plus is $50 off, plus you can add the EBV panel, or you can do the EBV panel on its own, but frankly, I would just bundle it because you get a lot more information. Or you can do this big 3 test, which has the thyroid, GI map testing, and hormone testing for $150 off. So that's a really great deal. So you just use the buy button, and then the rest happens. Again, this article will kind of lead you to some of the supplements in our shop. We have this code right here called Corona10 that gets you 10% off anything in the immune category, which is 2 pages of stuff, and I have information on all of it. I will say there's some concern, you know, probiotics aren't a fit for everyone. So if you have if you're really sick, you may not want to start a protocol like this without talking to your doctor. And you don't want to start, frankly, any of this without talking to your doctor. But if you're elderly, if you really got a lot of conditions and gut stuff, I wouldn't just start probiotics right now without some professional guidelines. You can also see us for a consultation. But some of my favorite things are here. We're selling a lot of vitamin C. I'm having trouble getting a hold of it, to be honest. We're selling a lot of this nasal spray. I'm not out of that. Silver spray. We've got vitamin D, which I said is one of my key things. Olive leaf would be more if you start to get sick. It's a nice antiviral. This is really where I'd start, this hormone care kit. It has magnesium, fish oil, and a multivitamin. This is just a great thing to do every day to keep your body stronger. I'm a big proponent there. So again, all these things are on sale with Corona 10. We have lowered our threshold for free shipping to $97. So as long as you spend $97, you'll get free shipping. And any questions? I think there's one question here that came in. Jen, do we look at all previous reports and give advice before doing your testing? So you can have a couple options here. If you just want us to look at your old stuff, we can do that. And that is a service called Past Labs Review. So if you're not sure if you want to retest, Jen, you just want us to look at your old tests, maybe that you got a bunch of tests, but then you didn't hit it off with that practitioner, you can do this Past Labs Review. You can give us a few labs or a lot of labs, and the price varies depending on that. If you run a new lab, like the thyroid test, we do not look at past unless you pay for it, because we were getting like a whole pile of extra work. So we will look at what you have. You can look back and compare it, or if you want us to compare it, you need to pay for the 2 sessions and we can put them together. If you have a complicated case, I think it's worthwhile. So you can do both, and that's you'll have an hour with us. It's very comprehensive that way, so you can go that way. It's still a fantastic price. You know, if you have 3 labs for us to review, it's $150. You have a half an hour, then we could go on to look at your current lab that you just ran. So those are the options. Hopefully that makes sense. We also have this consultation right here, supplement feedback review. I may put that on sale soon, so that if you want to just come to talk to us about your case and coronavirus, we're not doing treatment of coronavirus, just kind of general recommendations for your best health in consideration of coronavirus. So I think this is a great time to just motivate about your health and learn more. I think, you know, people feeling nervous about their pre-existing conditions. I don't want people to feel nervous, but I am glad that people are thinking about their health. So highest risk, right? Elderly, immunocompromised, asthma, COPD. I definitely would do working on your asthma with the magnesium and fish oil. I actually have some information, I think, in that article about magnesium. It's great for Epstein-Barr. It's great for asthma. It's great for immune boosting. It's very safe. The worst thing you can do is take too much and get diarrhea if you take too much. So I would take 300 milligrams in the morning, 300 at night, apart from each other. Shouldn't be a problem. If you're eating a ton of greens, maybe that's too much magnesium for you, but most of us aren't. Oh, Diane, yeah, I would say your EBV was pretty high. How do I know what's the best test to take, Jen asked? That's a great question. I'm happy to dig into that with you right here. You're having hot flashes. I would say, Jen, maybe do the big 3. It's the reason I created that kit, and it's kind of expensive, is because I really would like to see that on everyone. We're seeing your thyroid, your blood sugar, which probably if you're having hot flashes, your blood sugar's involved. We can see your immune system, your anemia. Then we see your whole hormone panel. If you're going through hormone issues, then we see your hormones. And then we see your whole gut panel. We see if you have infections, if you have a thin gut lining, that's a sign of poor immunity too, and toxicity. So I would do the big 3, Jen. You get an hour and a half with us. It's a lot. We almost have too much time. We can talk about everything, and we'll get everything figured out for you. Not figured out, but you know, we can be quite comprehensive if we run a big 3. And you know, you can save those results. You will refer to them in the future. If you want to test your blood labs again in a year, then you have something to compare to. It's great. It's a great session. Hi, thanks, Diane. Thanks for sending someone our way. Yeah, hyperthyroid, that's interesting. You know, it could potentially be some overactivity of the immune system. But again, we can't really tell for sure without testing. Any last questions? Thanks everyone for being on. I know this is a very stressful time. I think we'll have more resources around stress management as time goes by. But I am happy to use this time together, you know, to learn about health. Jen is asking, what's some other tests for you if you don't want to do the big 3? It's too expensive right now. I would say, you know, think about what your biggest complaint is. But this thyroid testing right now is $50 off. It's pretty affordable. It gets you time with us. We can review a lot of stuff, and it's a pretty great place to start because there's so many angles. You know, we talk blood sugar, thyroid, white blood cells, red blood cells, and vitamin D. It's a lot. So that could be a good place to start. And what is that now? On sale, that's $350, right? $347. It's a pretty good price point. It's a pretty appropriate thing right now with coronavirus. But Jen, if something is bothering you more, you might want to do just a hormone test or just a gut test. You're right, it can be hard to choose. I would just read them over. I have videos on them. There's some reviews that have been written. I think you'll get a better sense when you read it over, but I'd probably just start with the Thyroid Plus test. I think that would give us a lot of information. We can hear your whole health history. We can see what supplements you're taking, kind of give you a good place to start. You know, even without every single bit of testing information, if we have some testing results and we hear your story, we can put a lot together there to help you. So, and it's just I think it's a really fun and informative to talk with somebody that you connect with in their theory of health. I think that's what a lot of people are missing out on at their doctor's office. You might be a great person, but the theory isn't really a match, and the insurance system isn't really a match for what you want. You can use a health savings account with us, but we don't run insurance. We just really can't run insurance, but you can use a health savings account, credit card, and if it doesn't go through on our website, we can send you a PayPal invoice, and that will work. So that's something that can, help out a little bit. Great. Well, thanks everybody. I really appreciate you being here and learning with me. Stay well. We have lots more to come. We've got a whole long list of topics to present to you related to your immune system over the next few weeks here. Bye, everybody.